So next we're going to mobilise 2 exercises for the thoracic spine. The thoracic spine starts at C7, bottom of the neck, ends bottom of your ribs down here. There's 2 main directions we can mobilise this area. So we're mobilising the joints, but you will get a stretching effect to some degree. You'll also get some muscle activity as well, but we're aiming to mobilise the spine is our main aim here. So we're going to do a movement that is backwards forwards this way, which is posterior anterior or backwards forwards. And then we're going to do a rotation of the spine as well. So I'm going to use, to make an easy piece of equipment for all of us to use here, is a wall. So especially for people that can't comfortably get on the floor and then get off again. So we're going to stand closest to a wall like this. I'm about a foot to 18 inches away, bit of bend in your knees. Then leaning into the wall with my elbows here. Now the movement we're looking to do is to arch our back slightly, and then to drop the shoulders back and through, so we're arching our back and leaning in to force that movement a little bit, okay? There shouldn't be any particular feeling of pain. If anything, you'll find any achy pains should refine down to the centre of the spine as much as anything else as you're doing this, as you're going forwards, and it should feel quite pleasant. There shouldn't be a sharp pain, there shouldn't be anything radiating around your ribs. If you find something does radiate around the ribs, I would stop the movement, speak to a professional who can advise. So we're going to do somewhere between 10 to 20 of these. You could do these twice a day, probably a good idea, especially if you've got posture related problems because you've got office-based work or you're bending forward a lot. Or you could just do 20 once off in a day. Probably regularity is going to help you overall, I think. So that's ending that movement now. There. And then we're going to move into the second movement. So that's posterior, anterior, front to back. Same piece of equipment, a wall for the second rotation. It's almost like you're doing a press up, but standing against the wall here. I'm going to go to the right first. So I'm going to take the right hand away, solid position with the feet. I'm going to twist back as far as I can go, watching my hand. And I'm going to turn round to try and turn it to the other side. I'm just going to go through that movement about 8 to 10 times on each side. That's 2. So you can see it's rotating mostly towards the bottom of that thoracic area. That's where most of our rotation movement is. But there is some all the way through. You should be breathing when you're doing these exercises. In and out is my general recommendation, in that order. Some do out then in. But you can use whichever your preferred method is. And then we go to the other side, so back to the left, and then through. It's quite a common area to have immobility, stiffness, discomfort in the thoracic area these days. More computer work, looking at phones, Android or iPhone, works about the same, I find. And there we are, another 2. I'm going to feel a lot looser for that. There, okay, back to the middle, and then we're done with those 2 thoracic movements.